Welcome to the Adult Foster Care Division's video training on direct care staff requirements, qualifications, and training in adult foster care group homes. Let's take a closer look. Staffing levels and adequate training are perhaps the most important factors in the quality of care provided to residents and their ability to live with dignity in a long-term care setting. The Adult Foster Care Licensing Division is responsible for assessing staffing and training requirements to ensure the licensee is providing adequate care, supervision, and protection to all residents. Let's look at these individually, beginning with staffing requirements. A licensee shall always have sufficient direct care staff on duty for the supervision, personal care, and protection of residents and to provide the services specified in a resident's assessment plan, health care appraisal, and resident care agreement. At a minimum, the ratio of direct care staff to residents must not be less than 1 direct care staff to either of the following: 15 residents during waking hours or 20 residents during sleeping hours for large group homes and congregate facilities. 12 residents for small group and family homes. Sufficient direct care staff is defined to mean the number of staff necessary to implement the care needs as indicated in the resident's assessment plan, health care appraisal, and resident care agreement. Children under 12, who are a member of the household, count as residents for Sub-Rule 1A and B of this rule. An individual, including a volunteer, cook, or private duty staff, shall not be considered in determining the ratio of direct care staff to residents, unless the individual meets the qualifications of a direct care staff member and is providing direct care to residents on behalf of the licensee. Direct care staff need not be in the facility during the day, if all the residents are out of the home, as approved in the residence's assessment plans. The licensee shall provide contact information to residents or responsible parties in case of emergency or if a resident wants to return to the facility. The number of staff that is adequate and sufficient is variable and specific to the needs of residents and the capabilities of staff at a given point in time. The number may change based on various factors. On the screen are some examples. Needs of residents if emergency preparedness plans require implementation. Number of residents needing 2-person assistance or Hoyer lifts. Number of residents with chronic incontinence. Number of residents with elopement or aggressive behaviors. Number of residents with feeding needs. Number of new, inexperienced staff on duty. Number of new admissions, especially residents with dementia, and the needs of residents if emergency preparedness plans require implementation. Residents with increased anxiety or confusion require more staff attention, especially during the initial transition period. In addition to reviewing assessment plans, resident care agreements, and health appraisals, licensing consultants have the authority to request and review other various facility documents, as well as interview and observe staff and residents to assess the needs of the population being served. Licensing consultants will take into consideration how many residents have impaired mobility, challenging behaviors, and specialized personal care needs. The licensee is responsible for providing residents with needed services. How this responsibility is met is up to the licensee. The consultant will determine whether the ratio of direct care staff is sufficient but will not attempt to determine how many additional staff are necessary to meet the sufficient staff requirement. Licensing consultants can request and review staff schedules to determine how many staff members worked in a facility at any given time. Licensees are required to keep a copy of all direct care staff schedules for a minimum of 90 days. Schedules must include names of staff on duty, job titles, hours or shifts worked, date of schedule, and scheduling changes when made. Based upon the resident census, direct care staff schedules, and the types of care and services to be provided to each resident, licensing consultants can determine if staffing ratios are adequate. For example, if established several residents require the assistance of 2 direct care staff members to transfer and ambulate, scheduling 1 direct care staff member during both waking and sleeping hours would not be sufficient. When assessing whether a facility has sufficient direct care staff on duty, licensing consultants may request to review a licensee's emergency preparedness plan to determine if staff-to-resident ratios are sufficient enough to follow the facility's evacuation plan in case of an emergency. A licensee shall have a written emergency preparedness plan in case of fire, medical, weather, extended utility outage, or other emergencies. The plan must include where residents will receive care in the event the facility is no longer habitable. A licensee shall ensure that residents, volunteers, and members of the household are familiar with the emergency preparedness plan and any assigned responsibilities to carry out the plan. Licensing consultants may request to review practice drill records to determine if staff-to-resident ratios are sufficient enough to safely evacuate all residents from the facility in a timely manner. A licensee shall ensure that all staff are instructed and retrained quarterly per calendar year, and new staff upon hire, with respect to their duties and responsibilities under the Emergency Preparedness Plan, on the operation of the fire alarm, and on other fire protection equipment. A record of the instruction must be maintained for 2 years. A licensee shall practice the Emergency Preparedness Plan, including the Fire Safety Plan, at least once a quarter per calendar year, during each shift, 7 a.m. to 3 p.m., 3 p.m. to 11 p.m. and 11 p.m. to 7 a.m. A record of the practices must be maintained for 2 years. A facility that is licensed for 7 or more residents shall have a minimum of 1 staff member who is qualified by training, experience, and performance to be responsible for food preparation. Additional food service staff shall be employed as necessary to ensure regular and timely meals. Now, let's move on to direct care staff qualifications. Direct care staff members must be capable of meeting the physical, emotional, intellectual, and social needs of each resident, and capable of appropriately handling emergency situations. Administrative Licensing Rule ending in 629, Sub-Rule 2, A through E, allows for minor individuals, 16 or 17 years of age, to be considered as direct care staff, and counted toward the staff-to-resident ratio, if all the following criteria are met. The individual is under direct supervision of a fully trained direct care staff, who is on site at the facility and is at least 18 years of age. The individual does not provide transportation for the residents. The individual does not provide medication administration to the residents. The individual meets all the direct care staff training and requirements in these rules for the duties that the individual is assigned, and the individual receives parents' consent as required to undergo a background check pursuant to the Adult Foster Care Act. Our next topic of discussion is direct care staff training requirements. Written verification of completed training must be maintained in each employee's record. A licensee or administrator shall provide in-service training or make training available through other sources to direct care staff, and create a method to assure competency. We will discuss this further later in this video. According to Administrative Licensing Rule 400.629 Sub-Rule 5, direct care staff shall be trained and competent in all of the following areas before performing assigned tasks independently. Reporting requirements, first aid, cardiopulmonary resuscitation, which includes a hands-on demonstration as part of the training, personal care, supervision, and protection, resident rights, safety and fire prevention, prevention and containment of communicable diseases, including recognizing signs of illness, food safety, which includes food storage, preparation, distribution, and serving in a safe manner, and nutrition and special diets. Note: if an AFC Homes program statement includes the care of residents with Alzheimer's disease or related conditions, they must meet the provisions of the AFC Act, which includes additional staff training related to Alzheimer's disease. Training for Sub-Rule 5, B and C of this rule must be in accordance with these rules. The individual providing the training shall be trained in, and follow nationally recognized standards. Documentation of training must be maintained in the staff's record, to determine that the training has been completed and is current. The first training requirement we will discuss is reporting requirements. All training provided, or made available by the licensee or administrator to direct care staff, related to reporting requirements, must minimally address the following items indicated on the screen, and are explained in greater detail in the Adult Foster Care Technical Assistance Handbook. The next training requirement is first aid. Direct care staff members are to complete training in basic first aid, which should cover topics such as emergency aid for someone who is choking, bleeding, or in shock. Topics should also include treating burns, bites, stings, trauma to the eyes, ears, or nose, and the treatment of fractures, strokes, seizures, accidental drug overdoses, poisonings, and treatment for issues associated with diabetes. Acceptable sources of training in first aid include videos, local public health departments, the American Red Cross, licensed physicians, registered nurses, emergency medical technicians, and hospital staff. Documentation confirming the completion of a course in basic first aid is acceptable. The next training requirement is cardiopulmonary resuscitation, commonly known as CPR. As mentioned previously, competency in CPR is demonstrated by participation in a hands-on demonstration and successful completion of a CPR training course. According to Sub-Rule 6 of Administrative Licensing Rule ending in 629, the individual providing the training for first aid and CPR shall be trained in and follow nationally recognized standards. The next training requirement is personal care, supervision, and protection. The licensing consultant will confirm the licensee has a training methodology in place that assures all direct care staff are competent in providing the personal care, supervision, and protection to all residents in the facility, as identified in the facility's program statement and admission and discharge policies, as well as in resident assessment plans, health care appraisals, and resident care agreements. Remember, if the facility program statement includes the care of residents with Alzheimer's disease or related conditions, the facility must meet the provisions of MCL 400.726b. The next training requirement is resident rights. During inspections and investigations, the licensing consultant will determine whether the licensee's direct care staff training includes resident rights as contained under Adult Foster Care Administrative Licensing Rule ending in 681. The next training requirement is safety and fire prevention. The licensing consultant will determine that licensees have a training methodology in place that assures the competency of each direct care staff member in the area of safety and fire prevention that is appropriate to the needs of the current resident population identified in your facility's program statement and admission policy. Safety and fire prevention training should at minimum include the following: what to do during basic emergencies, including medical and weather emergencies and disasters, knowledge of responsibilities during emergency situations, knowledge of the facility's emergency plans, knowledge of what to do to assist residents with special needs, knowledge of how to prevent and respond to common types of home fires, and knowledge of the proper operation of fire extinguishers. Training resources may include, but are not limited to, local fire departments, fire safety and emergency preparedness training, and the National Fire Protection and Prevention Association training courses. The next training requirement is prevention and containment of communicable diseases. The licensing consultant will determine the licensee has a training methodology in place to assure direct care staff members are competent in the prevention and containment of communicable diseases, consistent with current OSHA guidelines on blood-borne pathogens. The training should address such areas as identification of situations where risk of exposure to blood-borne pathogens exists, recognizing the need to keep work and room surfaces clean, orderly, and in a safe and sanitary condition. Knowing the purpose of universal precautions, knowing what precautions should be taken to prevent the spread of disease, and knowledge of correct hand-washing procedures. Sources of training may include but are not limited to local health departments, American Red Cross, the Department of Health and Human Services, and community mental health agencies. The next training requirement is food safety. Topics should include at a minimum, food storage, preparation, distribution, serving in a safe manner, temperature control, cross-contamination prevention, and cleaning and sanitizing. Training sources include, but are not limited to, local health departments, the National Restaurant Association, community college courses, and online training options. The next direct care staff training requirement is nutrition and special diets. Documentation confirming the completion of a nutrition course, covering the basics of nutrition, food shopping, storage, and preparation, is acceptable. Acceptable sources of training include, but are not limited to, local public health departments, community college courses, and nutrition training provided by the Department of Health and Human Services. Direct care staff who administer medication must be trained in the proper handling and administration of medication. During inspections and investigations, licensing consultants may review the licensee's training and procedures for the administration of medications. The procedures must include, at the very least, the 5 R's of medication administration: right medication, right resident, right amount, right time, and right method. Licensees are to assure that persons responsible for food preparation have experience and training that will enable them to carry out their duties. During routine inspections, or in some cases during special investigations, consultants will verify compliance with this requirement. In the last section of this training, we will discuss common staff-related violations or issues. The first issue is floating staff members. It is not uncommon for some licensees who own and operate several AFC homes in close proximity to share staff members amongst multiple facilities. There is no adult foster care administrative licensing rule prohibiting licensees from scheduling direct care staff members who float amongst several facilities and assist with direct care wherever needed. However, floating staff members cannot be counted in your staff-to-resident ratio. Here's an example why. A direct care worker is scheduled to float between Facility 1 and Facility 2 to assist with residents who require two-person assistance with ambulation. While assisting in Facility 1, an evacuation emergency occurs in Facility 2. The direct care worker is not available to assist with the evacuation in Facility 2 in time. Direct care staff member recruitment and retention is among the most pressing challenges confronting long-term care providers. Research indicates a strong association between staffing levels, quality of care, and a facility's ability to maintain regulatory compliance. High direct care staff member turnover will place residents at greater risk and increase the risks associated with resident neglect. This could potentially result in significant adult foster care administrative licensing rule violations and possible disciplinary action. Volunteers may provide supplementary services in adult foster care homes. However, licensees cannot rely on volunteers to fill required staff positions and perform direct care staff responsibilities unless they meet direct care staff qualifications. Residents shall not be used as volunteers to provide resident care services. It is not uncommon for some licensees to utilize employment agencies, as it is permissible to use temporary direct care staff members. However, the licensee is responsible for complying with all adult foster care administrative licensing rules pertaining to all employees, including those from an employment agency. Note: it is the legal responsibility of the licensee to ensure fingerprint-based background checks, via the workforce background check system, are done on staffing agency employees and/or contractors with direct resident access in their facilities. Utilizing untrained staff as direct care members is a common issue. Licensee should only use life enrichment staff, dining staff, cooks, and maintenance staff as direct care staff members, if these individuals have been cross-trained and meet the qualifications of direct care staff members. Licensees should never utilize staff in areas where they are not trained. Another common issue is licensees failing to conduct required background checks on their staff members. Background check laws require licensees to conduct a fingerprint-based background check on persons with regular direct access to residents. These background checks must be conducted via the Workforce Background Check Program. Another common mistake licensees make is failing to obtain the appropriate health screenings for their staff members. A licensee shall have on file a statement signed by a licensed physician, or physician's appointee, attesting to the physical health of the licensee, staff, and members of the household. Statements for the licensee and administrator must be signed no more than 6 months before the issuance of a temporary license and at any other time requested by the department. Statements for staff and members of the household must be obtained within 30 days of their employment start date, assumption of duties, or occupancy in the facility. A licensee shall annually review, and maintain in the facility, the health status of all staff and members of the household. Verification of annual reviews must be maintained for 2 years. A licensee shall maintain documentation of a baseline screening for communicable diseases and records of illness on hiring. Staff who have direct physical contact with residents or resident food may perform those duties only when they are non-infectious or when proper precautions are taken to prevent the spread of a communicable disease. A licensee shall follow the guidance of a staff member's healthcare professional or local health department on controlling the spread of a communicable disease when identified. Missing verification of receipt of personnel policies and job descriptions in employee records is another common issue. Facility staff members are to receive a copy of your personnel policies and their specific job description. Licensing consultants will verify this during inspections, or in some cases during special investigations. Consultants may review job descriptions and personnel records for verification that facility staff members have the appropriate level of training to carry out their specific job duties. The last common issue I will discuss is missing required items in employee records. Employee records must contain all documentation specified in the Adult Foster Care Administrative Licensing Rule ending in 639, Sub-Rule 1, A through I, as listed on the screen. One of the most common missing pieces of documentation in employee records are the verification of reference checks done on staff members upon their hire. The licensee must create a process to verify reference checks of each employee. Employee records are to be made available for review at the time of an inspection or an unannounced investigation. Records must be maintained for 2 years after the staff member's ending date of employment. Thank you for watching our video training on direct care staff requirements, qualifications, and training in adult foster care homes. We hope you found this information helpful. We look forward to you joining us in the next video series on licensed adult foster care.